Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We have Carmen, and Leslie is one of the most cheerful, beautiful women who could come here at the radio station at 6:30 in the morning and just look lovely and have such a great attitude. And I have to ask you...
Oh, thank you.
See, Dr. Mencia got here early, so I said, okay, you can come
if
on the
Leslie
mic.
is coming, I better be here.
So this is the question that I have to ask you, Leslie, because you've been in the advanced laser therapy. Do you really believe that this whole thing with lasers, that's the new way for people to get rid of pain, that people shouldn't be taking all the medication and they should do it a different way?
Definitely, absolutely. I truly believe this because of various reasons. Number one, I have experienced that myself with my daughter, as I'm sure everybody knows right now. And I just see so many patients come in with pain medication, which just really makes you tired and non-receptive, and it slows down your metabolism because your digestion isn't working properly. So the pain medication, is obviously there when you have severe pain and you've had trauma and you need to get over a specific phase in your life. But long-term chronic illness, that's where lasers coming in. I think that's where lasers very, very important, because you don't want to take any kind of medication, long-term, over months and months and years. And giving laser therapy to our patients will reduce the inflammation, will increase your own healing. So it's really your own body doing this healing. That's what we're doing. And it can just help with a lot of other issues as well, sleeping and feeling better, and anxiety, depression, because we use various types of lasers in our clinic. Also something called the Delta laser that I know I've spoken about many times here. And that has those 4 modalities: laser, light, ultrasound, and magnets. And those 4 modalities together work beautifully together, and as a whole are fantastic in relieving anxiety, depression, and so forth. And at the same time, also giving your body healing through the adrenal glands, so your hormones work better, you just feel better. And if you're working as a body, if your cells are all working properly, then you're going to heal better.
Dr. Mencia, the fact you're here is a good point that we now know that and I just listening to an NPR show about the suicides and the people who are really into all these pain meds, and it's the whole country is this is one of the worst things in our country now, isn't it?
And South Florida is one of the worst area of pain medication. The statistics show nationwide that people under the age of 25 are using heroin. So they start with the pain medications, and eventually they end up using heroin to step it up to the next level. The other thing, if we look at how we have developed as a society, Vietnam War, Korean War, we used to go like pills. We used to go and try to hit the whole country. Then you look at the most modern world, where we can target the enemy, where we can hit one apartment without breaking down the whole building. And that's what laser therapy is all about.
He always does this. I mean, he has the most wonderful way of seeing things. We could be talking about something horrible, and he brings in carrots and celery.
I was telling one of my patients the other day about Leslie. I say, coming all the way up north was far. But I was saying, look, if you have tendinitis, and he was asking for prednisone and what have you, I said, listen, if you have tendinitis, I can give you a Percocet, I can give you a prednisone, but the pills is going to work all over your body. And if you are not used to taking Percocet or one of those pain medications, they're going to give you constipation. The reason they are giving you constipation is because the receptor that you are trying to hit in the area of inflammation, the area of concern, it could be your back, it could be your knee, your shoulder, it's going to start by your guts because you swallow the pill. So when you swallow the pill, the receptor get attacked at the guts first, and they stop moving. And then you get constipated. And if you used to be constipated, now you're going to get impacted. You're going to get worse. And then you start going through all the complications. Once they get absorbed, now they have to go through the liver. If you're taking a thyroid medication, if you're taking a cholesterol medication, if you're taking a diabetes or blood pressure medication, they are going to interact now with each other. So if there are things that you can do without taking medication, like what Leslie is saying, combining
Give
all
me the
this.
laser therapy.
Of course, yeah. Because all you're doing is stimulating your own immune system to act and protect your body. Look at a lot of, they say ladies, now men and ladies going through perimenopausal period, the hormonal changes. And they come to me and say, should I replace my hormone? Say, no, just fight it. Do meditation. Just get your own immune system to let them know that you still you're still awake. Yeah. And,
And so, Leslie, thank you, Dr. Mencia. That was a wonderful explanation, and I believe that, too. I don't like to take anything else. And I did have an experience long before I met you, maybe 3 or 4 years ago. I don't even know if I met I don't even think I knew Dr. Mencia. I don't know, but for some reason...
we've been together now.
Yeah, I know, a long time. I don't know. Maybe it was in my
Bill
dreams.
is not jealous anymore.
Maybe it was in my dreams, right? But I remember for no reason at all, I couldn't lift one of my arms. And I never had this, I couldn't lift it high. And so someone said, well, I have a chiropractor. I'd never been to a chiropractor. Okay, so I went. And what he did, it was some sort of a laser treatment. I can't tell you what it was. And, of course, he put heat and cold and all, but he used the laser treatment. But in 3 times, I could raise my hand. And now, maybe if I didn't go to him, Dr. Mencia, what would have happened if I didn't go and take care of it? Would it lock and just stay that way?
The number one complication is what we call a frozen shoulder. So it will freeze. The joint will basically freeze, like become bone attached to bone. So therefore, it become a frozen joint. So you don't have a shoulder anymore.
Whoa!
Right.
And I've had a lot of patients with frozen shoulders, and what laser does is actually stimulate the microcirculation to the joint and brings blood flow and energy, and then your muscles become loose because it increases the permeability of all your muscle cells, and then your joint is mobile again. And actually, every time we do laser, we see the shoulder is able to go up further and further.
So, see, I didn't use your system because I didn't know your system, but I totally enjoy and want to do that. So, anyone that's listening, if you have pain and you want to just have it done naturally, as Dr. Mencia said, go to the Advanced Laser Therapy with Carmen Care, and their phone number for you to for you to get there and to call them is 561-405-9577, 561-405-9577, or go on their website, carmencarelaser.com, carmencarelaser.com. Okay, so what kind of pain have you been doing? What kind of pain have you been relieving?
Well, you can literally start from the top all the way down.
You've been doing migraines.
Yes,
I remember that.
A lot of migraines. And actually, this is how it all started. I started just doing laser therapy. And we had about a 90% success rate, if we want to put that in those numbers. Then there was a 10% success rate 10% that weren't getting better. And I was like, oh, that frustrated me because I want to help everyone. So I started doing more research and came across laser energy detox and started studying that. It's Dr. Lee Cowden that actually invented this, came up with this theory. And we're all loaded with toxins, right, Dr. Mencia? I mean, it's like the air pollution, chemtrails, and aluminum in the water,
the air
deodorants,
conditioning,
oh my God, the fungus,
the car,
everything. Yeah, you're so right. You put on the car.
No way.
You know when you put on the car.
Yes, it's gorgeous car.
Unfortunately, fungus doesn't make any kind of.
No, exactly.
We don't have Richard Porter right now.
Yeah. Oh, he's driving a Lexus. No, we are not going to go in that one.
Unfortunately. So our body has all these toxins that actually slows down our natural healing system, especially fungus. It attaches itself to our respiratory system, and then we just can't breathe properly. We have sinuses. So all those things happen. Migraine. I can't tell you how many people have come to me with migraines, and now with additional detoxification of, let's say, dioxin, these herbicides, pesticides, their headaches actually disappear. Years and years of headaches gone within one session. Absolutely amazing. So, but back to the laser. Yes, we treat, migraine, neck, back, shoulders, wrist, carpal tunnel, tennis elbow, hips, lower back, sciatica, piriformis muscle, knees, ankles, you name it. Basically anything.
Okay, we know a lot of people with a carpal tunnel. We call it a
carpal tunnel syndrome.
Syndrome All right. So, how long would someone have to have the laser treatment for that to work?
Usually about 16 treatments. And it's a 20-minute treatment. And how I approach it is I look at all the possible things that could be causing this pain in the wrist. Even if it is diagnosed as carpal syndrome, I will treat the neck, because there's the nerve that comes out of the cervical area that can go all the way down into the arm. I treat the entire arm. I treat the wrist, the fingers, just anything that could be causing the pain, we treat. And that's why we have such a great success rate, because it's never going to hurt. We can never over-treat. That's the beauty of this.
Right.
You can't hurt anybody.
Right.
Well, Dr. Mencia, you have been, of course, a practicing physician for many years. And when you were in medical school, was there such a thing as laser treatment for pain? I mean, where has this all emerged from?
Well, in the late 80s, when I came out of school, magnet was what we've been, we were using.
That's true, right?
We were using the magnet, put it in the bed, put it in the chair. So laser didn't come until much later. I guess, what would you say?
Was approved here in 2000. When was it? 19. You know what? Now I'm drawing a blank. 2002, I think it was something like that. When
the
it was
late 90s,
yeah,
they
late
started
90s.
introducing, and then they started becoming more and more accurate. Yeah, just like I say for the war, it had evolved.
Right,
into
exactly.
much
More
more
I
accurate.
think a lot of the space age brought on so much too, didn't it? Things that can use now.
Well, in the last
Titanium
Star Wars movie,
Yeah, exactly.
they
yeah.
were. I was sitting there with my daughter Lee, and there's this big, animal with hair and everything got hurt, and they have this apparatus on there, and Lee goes, "Mom, that's a laser. They're using a laser."
And so that's it. And everybody, at least most people, don't want to take medication.
No.
And most people don't want to have a surgery. And this is such an easy way to do this.
Oh, for sure.
And so, and I think that your whole manner, the way you are you doing the treatments yourself?
Yes. Well, sometimes if I hurt myself somewhere, absolutely, I will put the laser on.
Do you?
Oh, you mean the facial?
No. Are you the practicing?
Oh, yes,
therapist?
absolutely. I
so
help.
You do it.
I help. This is normally I do the consultations. So I talk to the patient, see what is their problem, what is the root cause, try to get to the root cause, see if we can talk to their doctor, get MRIs and so forth, get the report, talk to them. And then I will sometimes do the first treatment just to put the script together to see how we're going to treat what will be the best course of action. And then I write that script and give it to our nurses who are laser therapy certified. And then they'll continue the treatment.
I see. And it's 20 minutes. And when someone leaves there, they may find a little relief, and then maybe it doesn't stick until the next one that they come. So it's
absolutely
over
correct.
and over again.
Yes.
They have to be patient.
Yes, and it's very interesting. There are different healing responses. So if we have a patient that comes in and they've torn a hamstring, we will do, that's an acute injury. We'll actually do 3 treatments within 24 hours. And the next day, they're practically able to walk again. So they have an amazing response because it was an acute injury. Somebody who comes to us with spinal stenosis, years and years of calcification, the narrowing of the spinal canal, years and years of pain, that is just going to take 20 treatments over the course of about 2 months, maybe a little bit of maintenance once every couple of weeks. So it really depends what your problem is. If we have somebody that comes in with neuralgia, some like after the shingles, post-herpetic neuralgia, that is a nerve condition. The skin, the nerves, go on top of the skin, are just extremely irritated, unbelievable pain. Well, I treated one patient once, just one time, 20 minutes, and his face relieved of pain. And he was like, I cannot believe that in 20 minutes, I am practically pain-free.
But now you can't put it on that because it would hurt.
Correct. Yes. But we put it on just very gently. We can just, lay the laser on there very, very gently, and it won't hurt. And again, we have various types of lasers. So if somebody has something that's stinging, burning, like he feels it's a hot sensation, I won't use a hot kind of a laser. I'll use the other one, the Delta, because those 4 therapies together really relieve the pain quite fast.
Dr. Mencia, this is, we don't talk miracles in health, but this is pretty special. I would think that this would be something that your patients could really enjoy.
Absolutely. And it's real life situation. And for those people that have doubts of the consequences of not doing something like this, is you go to a nursing home and see some of those patients there that have been there at least 5 years. You say, show me the one that live here 5 years or more. And a lot of them are contracted. The knees are frozen. The hips are frozen. It's hard to clean them up, to do good hygiene. The leg cannot be open.
You're making me so sad.
So, so we need to wake up, to a modern era that we are living now. Despite all the medication that we have out there, we cannot stop this. And it would take continued physical therapy with those patients to try to get those joints not to freeze on us. And despite everything that we have, they're still freezing. So even if your loved one is in a facility, I think LISA treatment will benefit those patients, to be able to go and get the treatment just to keep the joint mobile.
Yeah, that's interesting.
And all you're doing is maintaining good quality of life, because you're not doing anything to prolong life. You're not forcing the person to live longer.
Right.
You are just making sure that whatever God decides how long they're going to be on this earth, that we can keep them with good quality of life.
Beautifully said.
Yeah, that is. See, you don't think about that, but he's so right. Now, have you gone to nursing homes?
Yes, we have gone to nursing
You
homes.
have?
And I was just at the Chamber of Commerce the other day, and at the Sean Group, and that's a meeting of the South Florida professional group in the medical industry. And I'm trying to get into with these people that do the nursing homes, the facilities, because this Delta laser is so easy to carry. You saw it. It's just a little handpiece, like a flashlight. And it's so easy to literally just walk into the nursing homes and treat people. It would be something done quite easily and quite fast and really not that expensive.
Well,
and we could sell these lasers to the home
Yeah, that's
care.
what I want you to talk to you about. So now you have convinced someone that they're going to feel better, but then they can't keep coming to you. So you're saying that you will sell the lasers to them and then stay on top of that with them.
Exactly. So I have many patients that come to us first so that they get an evaluation. They learn how does laser help me. They gain confidence that laser is going to actually take their pain away and help them with their chronic illness. So then they decide, well, this is really great. I can't keep coming here for the rest of my life. So we sell them the laser, give them an education so they get training, and we support them. So I give everybody my cell phone number. I'm always texting, yes, do this, do that, do this for your certain pain. And they just treat themselves. And after a while, they get so familiar with the laser that they're treating their mom, their dad, their kids, their grandkids. If the kids come in with a tummy ache, you can put this laser on the tummy. We'll get rid of the tummy ache right away. If you have constipation, like you were talking about, you put the laser in a circular motion and you can actually stimulate your gut to move the bowel. So that's really fantastic as well. Something very important, there's a lot of wound care, a lot of decubitus. This laser will close the wounds. I even have a picture, on my seminar. I had a patient come to me who had a big wound due to diabetes, and he stepped on a stone, and that caused a big hole in his foot. He had a cast on for like a boot. Every Wednesday, I had to get a new boot. The physician had to cut out the dead skin.
Skin.
Exactly. But the wound just wouldn't heal. 20 treatments later, the wound is closed with our laser.
This is just absolutely fabulous. So this is Leslie Carmen, and of course you've heard Dr. Mencia. They're not connected in a way, but they are because of love and wanting to help people. I just want everyone to know this. Carmen Care, Advanced Laser Therapy, and Leslie Carmen is our guest. Phone number is 561-405-9577, 405-9577. The nice thing is you can have a free consultation. If you're in pain, please don't take any more of the medication. Go see Carmen, go see Leslie, and just see if there's some stuff that they can do to help you. They do have, their main office is Boca, but you are listed as having a way to meet people in Plantation
Correct.
and Aventura.
Yes, correct.
That if people live in that area, you'll set up appointments and then go down there. That's absolutely fabulous. I guess, Dr. Mencia, so you've been watching the whole world with lasers in many ways. I mean, like in the hospitals, we have so many big treatments now that really basically, I guess they are laser
driven. Absolutely. And, it cut down on hospital stay. It cuts down on the type of incision that we make in the body so that we can make smaller incision and the body recuperate much faster.
It's funny. Laser light, I remember, it's funny, years and years ago, I went to, maybe it was Disney. They had a whole laser light show.
Yes.
I remember the laser light shows. I think I was in Europe, as a matter of fact, for Independence Day. So I remember this. It looked like fireworks, but it wasn't. It was laser lights. Now, are those the same lasers? What is a laser?
Well, laser actually stands for. Now, let me see if I can say it. It's an acronym for light amplification by stimulated emission by radiation.
Yeah.
Right. Oh, wow. That's a tongue twister.
10 minutes to 7 in the morning.
But you see, you have laser pointers, right, that we use.
Yes.
So those are lasers as well. And you believe it or not, if you get a red one, because red fights inflammation and pain, and you have, let's say, pain anywhere, you can hold that laser on your pain and it will help.
Ooh, I have some of those pointers at the office. Cool.
Yeah, right. That's
No,
right.
you
You
can.
have a red. That's
Yeah.
right. The point. Right.
Right,
red.
but here I love to compare this with water, with giving a plant water. Okay, so laser is like giving us energy to our body. Let's put it that way. And water is like giving, obviously water to a plant, so it lives. Now, if you give a plant just with a little dropper, like a medical dropper, 2 drops, not much is going to happen, right? Although it needs that water. So, but it needs the right amount of water. So you're going to give it to it with a hose or something like that. Mm-hmm. And that's how I see the laser, the pointer, like the laser light. It needs that light, but it's going to take you 2 hours to hold it there to get that energy and to get that healing. And so that sometimes is a little bit disturbing to me when I read studies. I can sometimes get a bit frustrated because I'll read these studies that have been put out and the title will say, does laser therapy help with, let's say, some torn meniscus or something like that. And then on the bottom it says the conclusion, no, it does not help with it, because they've done a study. Now, I looked at this study and there was one specific study that I have in mind. They used rats and that's fine, but they put the laser for 10 seconds to the joint. Then the other group was 7 rats for 3 days, 10 seconds, and then for 7 days, 10 seconds. Well, if you put a laser 10 seconds anywhere, it's not going to achieve anything, especially
it's the 2 drops.
Yeah, it's
There's
the 2 drops of water.
Yeah.
Exactly. So that's really when we have to be so careful when we read these conclusions of the studies. You have to go and read, you got to read between the lines and say, okay, so what were the parameters? What was done? How much energy was given? And those are things that, unfortunately, not everybody understands. It's taken me years to read and understand that it's about the kilojoules, it's about the delivery, it's about the time, it's how much time, where, when, what. That 2 drops of anything is just not going to be enough.
So, okay, everyone who's listening to this radio show, do you really want to get out of pain? If you do, why don't you go talk to Leslie? And why don't you see what she can do? She certainly has convinced me. I don't have any pain now, but trust me, if I have any pain, I'm going to be on your doorstep.
Thank you.
After Dr. Mencia refers me.
Yeah, absolutely. I'll be happy to take the referral. And I'm going to refer my patients to Dr. Mencia.
There you go, Leslie.
But we don't want to say miracles.
But it does sound
this
like
is
it.
This is part of the new technology, though.
Yeah,
we know that.
it's cutting edge
When
technology.
you think about it, Dr. Mencia and Leslie, when someone broke their leg or they twisted something, they were in bed with their leg up. Now people are walking around with what they call their boot, right? They don't even use. Do they ever take and use a cast anymore, Dr. Mencia?
No.
So things have just changed so much.
That you just strap and keep it neutral, and then when you go to bed, you can unstrap it and take a shower and things that we couldn't do before.
And it will heal.
And it will heal even better because your muscle won't become too atrophied, too weak.
And what I like about that is now laser therapy really can work well because we used to drill a little hole in the cast to get the laser there. So
we
now,
did?
yes, well, we didn't, but the people that I've trained with, they used to drill a little hole in the cast just to keep the laser there. So now actually you can take the boot off, give laser therapy, which increases the healing by trifold, then put the boot back on and go about your day.
We're just living in a very exciting time, aren't we?
Absolutely.
Especially because, we all want to live a long time. I mean, I have my husband, and I told him I'd kill him if he didn't live to be 100. But the thing is, we want him to to be well. And Dr. Mencia, you should know something. Bill has added to his prune regimen. He has added bran muffins because I was going to make them. And I said, bran muffins will do it. Wow, that has really done it. Just so you can add that to your, when people are having problems. My husband was constipated and Dr. Mencia.
He was having shortness of breath.
Yeah, he was having shortness of breath because he was too filled up. And we had another doctor that my husband normally went to, said, oh, you're going to do this, you're going to add this and that. And I said, Bill, just go see Dr. Mencia.
He was too full and it wasn't air.
Oh, yeah. He said, full of you know what. But this other doctor said, you can't fly on the plane, you can't do this, I want you to do this. And Dr. Mencia,
I want you to do a stress test, and I want you to do this for the lung. It's not in the lung, it's in the gut.
That's right. And he knew immediately. But just within 5 minutes, he looked at Bill and took care of it. So that's how I see laser therapy. Stop with all the medication and all the, thinking about surgery. Try it at least.
Exactly.
And give it a chance. Right. So we feel like this.
And one thing, Leslie say about using the pointer. Going back to the analogy of the plant. If you put too much water in the plant, you're going to kill it. If you put too little water, you're going to kill the plant. You have to put enough. So the treatment that she's doing is specific to treat condition. So it's not grabbing any laser that you find out there and just start using it.
That's right. That's a very good point, Dr. Mencia. You have to go with a professional.
Right.
So don't go to the drugstore and it has a laser or something. Go to someone who knows what they're doing. They can analyze it. As you said very intelligently, that just because they came in for carpal tunnel and now you're working on their neck, sure, one thing could have something, but they're not even thinking that way, right?
Absolutely.
Oh, well, this has been
And we
great.
see it all the time. We see patients that are ready to go for carpal tunnel surgery and say, hold your horses. Your problem is not in your wrist, it's in your neck. We have to treat your neck. I see that all the time.
Yeah,
Yes,
yeah.
Leslie.
Well, thank you for being here with us.
Thank you. Thank you, Dr.
Mencia. I guess
You're welcome.
stay with me. I'm not letting him go right now. But you've been wonderful to do this with us, Leslie.
Absolutely.
Really.
I appreciate it.
Good
Thank
to
you
be
so
with you,
much.
Leslie.
And we
Good to
sure
be with
want people to call you at 561-405-9577. Thank you.
you. Thank you.